Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing miscarriage, or what used to be known as spontaneous abortion. Miscarriage is the spontaneous expulsion of the product of conception before 24 weeks of gestation. It occurs between 10 and 20% of pregnancies, and it usually occurs in the first trimester, which is within the first 13 weeks of the pregnancy. 50% of conceptions actually end up as spontaneous miscarriages. In this proportion, 35% are known as biochemical pregnancies. This occurs when between 7 to 10 days after conception, if pregnancy hormones like beta-HCG are measured, it is shown that pregnancy has occurred. But then miscarriage occurs within 14 days. Because of this interval, most of the time the woman doesn't even know she's pregnant. If you're confused about how to calculate your menstrual cycle, you can refer back to my earlier video on using the calendar method. There are some things that are associated with miscarriage. Things like increased parity, which is the number of times the mother has been pregnant. With increased parity, there's increased association of miscarriage. Optimal pregnancy interval is 12 to 36 weeks. So anything outside this range is associated with an increased risk. Previous fetal loss is associated with miscarriage. Previous medical termination of pregnancy with prostaglandins is associated with miscarriage, and this might be due to resultant cervical incompetence or uterine synechia. The causes of miscarriage can broadly be divided into three, which are the maternal causes, the paternal causes, and fetal causes. In 10% of cases under the maternal causes, illnesses like febrile illnesses can cause miscarriage. Chromosomal abnormalities can also cause miscarriage. And in those between 0 to 7 weeks, up to 60% might be due to chromosomal abnormalities. And between 8 to 12 weeks, about 23% of pregnancies might be due to chromosomal abnormalities. Increasing maternal age might also cause miscarriages. In those less than 30 years, there's a less than 2% chance of a miscarriage in the first trimester. But this risk increases to 5 to 10% in those that are more than 40 years old. Thyroid dysfunction can cause miscarriage. Problems with prostaglandin, as earlier mentioned, can cause miscarriages. Autoimmune diseases like systemic lupus erythematosus or SLE can cause miscarriage. Uterine problems like bicornate uterus can cause miscarriage, or even things like fibroids. Also, problems with the cervix like cervical incompetence can cause miscarriage. There are some infections which the acronym TORCH is used for, which include things like toxoplasmosis, HIV, syphilis, gonorrhea, rubella, cytomegalovirus, hepatitis, and herpes infections can cause miscarriage. Paternal causes of miscarriage include chromosomal abnormalities, increasing paternal age, and some immunological reactions whereby the body of the woman rejects the sperm or it does not survive long in the body. Fetal causes include chromosomal abnormalities, whereby 60% of cases might be due to this. And in 20% of cases, structural abnormalities, things like anencephaly, where there is no head development, might lead to miscarriages. Types of miscarriage include threatened miscarriage. In this type, there might be some pain and minimal bleeding. The cervical os is closed. An ultrasound scan will show fetal heart. In inevitable miscarriage, there's pain and bleeding. The cervical os is open. An ultrasound scan will show fetal heart. In incomplete miscarriage, there might be pain and there's bleeding. The cervical os might be open or closed, and an ultrasound scan might show products of conception, and there might or might not be fetal heart. In complete miscarriage, the cervical os is closed. There might be no pain or bleeding. An ultrasound scan does not show any fetal heart. In missed miscarriage, there might be some brownish bleeding and no pain. If it occurs later on in the pregnancy, the woman might realize her tummy is not growing according to the number of weeks she is pregnant. Ultrasound scan shows no fetal heart. There's recurrent miscarriage, where a woman has had 3 or more consecutive miscarriages. In these cases, further investigation is needed to determine the cause. There's septic miscarriage, which might follow incomplete miscarriage or a medical termination of pregnancy. In this case, the woman needs to be seen immediately to prevent generalized infections. The main thing to be aware of in miscarriage is to differentiate it from ectopic pregnancy. In ectopic pregnancies, the pain comes first and then there's bleeding. In miscarriages, the bleeding comes first and then there's pain. But if there is any doubt, it is always good to seek the help of a gynecologist at this time. Management of miscarriage includes conservative or expectant management. In this case, the woman is observed for 7 to 10 days to see the outcome of the pregnancy, whether it will be retained or will be lost. If it is lost, it's advisable 3 weeks later to do a pregnancy test to ensure all products of conception are gone. There is medical management, whereby misoprostol is inserted into the vagina. The woman might bleed up to 3 weeks after medical management, and it's advised that the woman does a pregnancy test 3 weeks after to ensure all products of conception are gone. There is surgical management, which can be done either through local anesthesia or general anesthesia, and includes things like vacuum aspiration. In all these cases, it's good to seek the advice of a gynecologist to know which one is best suited for your case. For those who are rhesus negative, an anti-D injection might be needed to prevent rhesus incompatibility in the future. Never forget the psychological management of a miscarriage. It is often overlooked, but is a very, very important part of miscarriage. It seems to be a taboo in many cultures not to talk about the miscarriage and just to allow the woman to get on with life. But she does need to grieve. She does need that support at that time. There are some associations like the American Pregnancy Association and the Miscarriage Association which can help to deal with these problems. There might also be some local associations, so it's good to be on the lookout. If you have been affected and there are no local associations, it might be worth starting up one, and you'll be surprised how it can influence those around you. Please watch this video as many times as possible, share, subscribe to my channel, and until next week, smile because it's healthy. And for those that are celebrating Mother's Day, happy Mother's Day. Bye.